आम्ही सर जॉईन झालेले आहेत. आपण स्टार्ट करू शकतो. दुसरे तर कोणी आता येतील असं वाटत नाही.
हो, लेट स्टार्ट.
चालेल चालेल.
हम्म.
सर
हॅलो अमेय सर. हॅलो. येस. गुड इव्हनिंग सर.
Good evening, please.
हॅलो गुड इव्हनिंग.
Good evening, good evening.
Very good evening, sir. Very good evening.
सर आपण स्टार्ट करूया.
हो,
आय एम ऑफिस बेरर्स आज बिझी आहेत. दे मे नॉट जॉईन.
No problem.
येस. येस
चलो.
शिवानी जी प्लीज स्टार्ट.
Yes, sir. Yeah.
यू कॅन गो लाईव्ह.
Good evening. Yes, sir. We are on live. We are live. Okay. Okay. Good evening, everybody. I would like to welcome you all to the IMA Sexual Health Committee with association with AMOGS in Core Connect live webinar. So I welcome to our conveners, Mr. Dr. Madan Kamble sir, Dr. Parul, Dr. Rakhi. So Dr. Madan Kamble sir is a MD, Obscene Gynae Zonal Coordinator at AMOGS, National Coordinator at FOXY Sexual Health and STI Committee, and a Chairman of Sexual Health Committee IMA-MS. So welcome you to sir.
येस थँक्यू.
And Dr. Parul, co-chairman of Sexual Health Committee IMA-MS. So I welcome you, ma'am. And Dr. Rakhi Sarda, a convener Sexual Health Committee IMA-MS. So welcome you to this webinar, ma'am.
Yes, thank you, Ms. Shivani, for the kind introductions. Good evening, everyone. On behalf of Indian Medical Association, Maharashtra State Sexual Health Committee and AMOGS, our own family of AMOGS, I take this privilege to welcome you all for this special webinar organized by AMOGS and IMA in joint collaboration. We do we do all the online activities mainly on focusing the sexual health to create the awareness amongst all the doctor fraternity, especially gynecologists and our general practitioners, IMA members of Maharashtra. So for this session, with the blessings of AMOGS office bearers, Dr. Amay Purandare sir, President AMOGS, and Dr. Rohan Palsetkar, Honorary Secretary AMOGS, and IMA office bearers, Dr. Santosh Kulkarni, who is the President, and Dr. Vikrant Desai sir, who is the Honorary Secretary of IMA Maharashtra State. I welcome you all on behalf of both the organizations. We are very delighted to have the chief guest today, our own President AMOGS, Dr. Amay Purandare sir, and Dr. Santosh Kulkarni, the President of State President of IMA. And the guest of honors, Dr. Manjusha Giri Madam, who is the President-elect IMA-MS for the next year, and Dr. Vinki Rukwani, who is the President of Maharashtra Medical Council. Somehow, due to some emergency reasons, they are unable to join today, but they have conveyed their blessings and wishes personally. So we have got a very eminent speaker today, who is the very well-known TEDx speaker, a sexologist, well-trainer, Dr. Mundra sir from Mumbai, and he is talking on a special talk, which is the sexual health in digital age. We are very eager to listen him. So may I request Shivani to play the video of lamp lighting, and I request all the dignitaries to join e-lamp lighting.
असतो मा सद्गमय तमसो मा ज्योतिर्गमय
also welcome today's eminent and dynamic chairpersons, Dr. Kiran Sada Madam and Nagina Naidu Madam, who are the honorary joint secretaries of IMA Maharashtra State. I welcome both of them. Now I welcome our chief guest, Dr. Amey Purandare sir, the young and dynamic, very supportive person who is the president of AMOGS, and he is very keen to have special activities and special focus on this sexual and aesthetic aspect. Sir is always taking initiative to have some activities on sexual health and keeping the good activities and awareness for the young gynecologists. So the dais is yours, sir.
Thank you, Madan. Hope I am seen and heard properly.
Yes, sir.
Yes, sir.
It gives me great privilege to be with you as chief guest for this important webinar on the topic of sexual health as a joint collaboration between the Indian Medical Association Maharashtra State Sexual Health Committee and the Association of Maharashtra Obstetrics and Gynec Societies, AMOGS. I'm indeed privileged to be sharing the stage along with Dr. Santosh Kulkarni, who is our president of IMA Maharashtra State. And I also acknowledge the presence of Dr. Rohan Pachetkar, Honorary Secretary of AMOGS, and Dr. Vikrant Desai, Honorary Secretary of IMA Maharashtra State. It is a pleasure to have as guest of honor two very eminent personalities, Dr. Manjusha Giri, who will be the next president. She is the president-elect of IMA Maharashtra State, and Dr. Vicky Udani, who is the president of the Maharashtra Medical Council. I especially congratulate Dr. Madan Kamble, chairman of the Maharashtra State IMA Sexual Health Committee, zonal coordinator of AMOGS, and who will be very soon, hopefully, rising to chairperson's post in FOXI of Sexual Health Committee. Dr. Parul Savji, also convener or co-chair of Sexual Health Committee of IMA Maharashtra State, and also Dr. Rakhi Sada, who is the convener of the Sexual Health Committee of IMA Maharashtra State. All of them have put together hard efforts to prepare this program and execute it. I'm thankful to Corona for providing the educational support and grant for this program which will be of academic interest to all those who are attending it. It is our great privilege to have an eminent and excellent speaker in the form of Dr. Sagar Mundada, who is a well-known psychiatrist, a sexologist, and a TED speaker from Mumbai. And Dr. Sagar will be talking on the interesting, but not only interesting, but important topic of sexual health in the digital age. Chairpersons for his session will be Dr. Kiran Sada, who is the Honorary Joint Secretary of IMA Maharashtra State, and Dr. Nagina Naidu, who is also the Honorary Joint Secretary of IMA Maharashtra State. I am happy that this program is being conducted as a collaborative effort between AMOGS and IMA Maharashtra State. Once again, I congratulate the conveners. I'm especially happy to be associating with both the MMC and the IMA in Maharashtra, as AMOGS always believes that collective collaboration will help in amplifying academics, which will translate into impactful upliftment of women's health and sexual health, not just in Maharashtra, but beyond. Thankful to the delegates for attending, and I'm sure that you will learn a lot and be extremely delighted to be hearing Dr. Sagar, who is a very well-known speaker. Thank you once again for having me, and I wish the program all the best.
Thank you, Amey sir, for being with us today and for your blessings. Thank you so much. We take this privilege to welcome Dr. Jyoti Chidgupkar Madam, who is with us today. She is the Vice President of AMOGS, Vice President IMA Maharashtra State. Jyoti ma'am.
Yes, Madan. Good evening, everyone.
Yes, ma'am. We are eager to have your words of wisdom. Yeah. Please, ma'am.
I would like to congratulate you on and your team on organizing such a graceful CME on a very essential subject of sexual health. And really, it is IMA and AMOX which they are participating in this CME, and it's very useful, I know. And your efforts, I'm sure many people will join soon and will be able to communicate a lot of things to many of our colleagues. Thank you and all the best for this today's session. Thank you very much.
Yes, thank you, madam, for your blessings and being with us today. Thank you so much. Thank you once again, Amey sir. Now we will proceed to the scientific sessions. Over to you, Parul.
Thank you, Madan sir. We'll be having our top-notch session today, which is sexual health in digital age. For this, I would like to invite our chairpersons. Firstly, being Dr. Kiran Sada ma'am. She is the honorary joint secretary for IMA Maharashtra State. Ma'am has so many accolades to herself. Can you please display the CV?
Yes, ma'am.
Ma'am has done her MBBS from Government Medical College, Sambhaji. She's the owner of Sarda Hospital in Samrat Chowk. At present, as we have already told, that she's the Joint Secretary of IMA Maharashtra State. She was the IMA President, Solapur branch in 2024, and she also received the Best President Award from Maharashtra State. Ma'am has been the president for Solapur OBGY Society, and she has been involved in a lot of social activities. So we wholeheartedly welcome you, Kiran ma'am.
Thank you. Thank you, Parul, for kind introduction.
I would like to invite our next chairperson for the session, Dr. Nagina Naidu ma'am. Ma'am is the Honorary Joint Secretary, IMA Maharashtra State. She is also the member of IMA Headquarters Organ Donation Committee. She has been the Zonal Coordinator for IMA Maharashtra State for HPV vaccination. She has been the Treasurer of COGS 2325. She is the organizing treasurer among State Conference 2025. And ma'am has a lot of awards to herself, like IMA Maha Youth Icon Award and IMA Maharashtra State Awardee for Best Honorary Secretary Local Branch, and also IMA National Awardee for Best Honorary Secretary Local Branch 2023. Ma'am has also got a Mox Youth Icon Award in 2025. We welcome you, Nagina ma'am.
Thank you so much, ma'am.
And now I would request our chairpersons to introduce our dynamic speaker for today, Sagar Mundra sir.
Yeah, let me take the privilege then. I'll introduce Sagar sir, and before that, I'll just say whatever Amey Purandare sir has said, Tathastu, in reference to whatever he said for Foxy chairperson, for our dynamic chairperson, Dr. Madan Kamble sir. And the second thing is, Parul madam, खूप पाऊस पाठवून दिला तुम्ही चंद्रपूरला. धुवाधार पाऊस सुरू आहे इकडे सुद्धा. The Wi-Fi is not there. That's why I'm not visible. I'm only audible. So now coming towards the topic, it is the dynamic speaker. Since start, I'm listening that Amey sir also said, Madan sir also said, he's a TEDx speaker and he's a very dynamic sexology psychiatrist वगैरह. But some points which I got triggered out कि he is the MD psychiatry topper in MHS 2016 and he's the best resident doctor. Most of the time, best resident banna is a big stigma also sometimes, but he is the best residence means that is a great thing. And with that, he is the best MART president also. In the year of 2016, and he was also the chairman of IMA Youth Wing Maharashtra State. I had seen him in the Maharashtra State, and when I used to every time see him, I used to like, ये इतना young, dynamic, handsome लड़का हमारे जनता में क्यों नहीं था? So over to you, Sagar Mundra. The all house is yours.
Thank you so much. Can you hear? Am I audible and visible?
Yes.
Yeah, very clear, very clear.
Superb. Thank you so much, Dr. Naginaji. What a wonderful introduction. I am blushing here. Thank you so much. First of all, thank you. A big thank you to Dr. Kamble sir for being gracious enough to invite me. Sir had actually connected with me 2-3 months back regarding one of the sessions, but that time it was not possible. So I am very grateful for him that he considered me again for this session. And I think the topic that we are going to cover today is very relevant to each and every person in any corner of Maharashtra or any corner of the world. Before I start, again, my warmest regards for all the chairpersons, for all the faculty who have joined here, and I hope that I can give some value addition at the end of this hour. A caveat though, before I start, I will try and keep the audience interactive, and I will try and crack a few jokes. So please take it in jest. Please do not take it seriously. We have a very nice topic, which if we kind of take it in jest and comically talk about it, we'll have some take-home messages also and have a good time also. So on that note, let me just start sharing the drive, and I would request Corona to please grant me access for the same. All right. Can you see the thing?
No, sir, it is not visible.
Let me try it again. Now is it visible?
The screen is showing started sharing.
Yeah,
Still,
but is it visible to?
It has not come yet.
Okay, just let me try again. What about now?
No, sir, it's still the same.
It's still the same. Let me try and do one thing. Let me leave and again join, and I think that will work.
Manjusha madam is there.
I just
Hello.
want. Hello, ma'am.
Yes. Good evening, madam.
Hi,
Good evening.
कैसे हो? Good
All
evening.
good, ma'am. Thank you so much for joining from the
But-
flight and being so
But I have
generous.
to.
Yes, welcome, welcome, ma'am.
Yes. इतने ही लोग आए हैं? Only 6 persons?
नहीं ये फैकल्टी लिंक है सिर्फ.
अच्छा.
डेलीगेट लिंक इज सेपरेट.
Okay, okay. So it's going on live?
मैडम आप बोलिए. जस्ट वी वांट टू हियर यू. जस्ट इनॉग्रेशन हो गया अभी.
Okay, okay.
Say
Continue.
few words. Yes, say few words.
So all the best wishes to our team led by Dr. Madan Kamble sir and Parul Sahuji madam, and then all Jyoti Chidgupkar madam, Neha Joshi madam, and our team members. And Kiran Sada madam is there. I can see her.
Yes, yes.
And congratulations for your webinar.
unlucky because I'm not able to hear all the things, but I'm lucky because after recording, I can see. Best wishes for your webinar. Thank you.
Yes,
Thank you
thank you
so much, ma'am.
Thank you so much. सर ज्वाइन हुए क्या? नहीं
नहीं
हुए?
सर, अभी तक ज्वाइन नहीं हुए सर।
उन्होंने मुझे भेजा है पीपीटी, लेकिन
कौन
वो
कौन?
कैनवा में है।
मुंद्रा सर, एक्चुअली मैम द स्पीकर हियर जॉइन, बट उनका वो पीपीटी शो नहीं हो रहा था, सो ही
Okay.
लेफ्ट एंड जॉइनिंग अगेन, सो वी आर जस्ट वेटिंग हिम, ही जॉइंड अगेन। हेलो
Okay.
सागर सर। Sir, you are muted.
Yeah. There seems to be some issue. Let me try and because I'm trying to share, but it is not sharing the screen.
Shall I share from my side?
Yeah, I think that would be great, sir, if we can do that. That's what we discussed.
But actually, it is in Canva, no? Okay.
Try and share it, please.
Okay. Just a minute. Yeah.
You
Is it
can,
okay?
yes sir, so you just start the PPT, matlab this presenter view. Yes,
Is it full screen, na?
yes sir,
screen.
now we can see, now we can see.
Sir, you can start. I will change the slides from here.
Yes, superb. I think we'll have to. Hello?
Yes sir, we can hear you.
We'll have to do a joint coordinated effort. Yes, all right. Finally, we can start. Thank you so much for waiting. So today's topic is very, very interesting. Digital age sexual health. How is sexual health changing in today's digital age? This is something that we see every day in our clinical practice. I am sure all the gynecologists and all the esteemed general physicians also who are attending this must be seeing that ever since the advent of social media, internet, and how it has directly entered into our lives so prominently, sexual health is also greatly getting affected. Some years ago, we used to say when we were children, as far as sexual health is concerned, the first teacher used to be certain magazines, or the first teacher for good students used to be their school. But now, almost universally, if you look at it, the first teacher about sexual health today is not a parent, it is not a doctor, it is not the school, but it is almost always the internet. So the first teacher about sexual health today is the internet, and therefore this topic is so important, because if we do not understand what the first teacher is doing with us, then our sexual health will be entirely compromised. So to understand how it is affecting, I have tried to create 5 simple cases, and through these cases I'll try and illustrate how sexual health, how sexuality, how sexual health problems are changing, and how the internet is the biggest player in all of this. I request sir to please move on with the slide. All right, so the first case is digital sexual compulsivity. Now, before you go and read what is written there, I want you to just picture one thing. Everybody has seen the movie Pati, Patni aur Wo. I want you to add some more things here. The name of this case, or in fact this movie, is Pati, Patni aur Wo, aur Wo, aur Wo, aur Wo. So there are so many woes here. The case that I'm talking of is a 35-year-old married man. Now, this 35-year-old married man, he came to us about a year back. He stays in Dadar, has a wonderful business, but he came to us, or rather was dragged to us by his wife. Now, what was the wife's primary complaint? The wife's primary complaint, and this will really blow your mind, dear doctors, was that Dr. Saab, my husband is a fantastic person. He takes care of all my needs. He is a very gentleman kind of a person. But since 2 years, we have not engaged in intimacy at all. So I was like, then what do you guys do? How does he fulfill his wishes? How do you fulfill your basic desires? So she said that this man talks to multiple females on the video call, and he self-stimulates while he is talking to multiple females. Now, really, I was also taken aback, but as a psychiatrist, the first rule that we have is no matter what you're feeling inside, outside, it has to be a very, very stoic face. So I was like, okay. But internally, I was also very perplexed. What is happening? So when we took a detailed history, we understood that this man has many multiple female friends. Many of them are professional sex workers whom he just talks on video call. And after he has a talk with them, he feels sexually aroused, and then he engages in self-stimulation, he engages in masturbation. Now, it has gone to an extent that he's spending hours in these chats. He has absolutely lost all interest in his spouse. And whenever he's tried to stop it, he has been totally unsuccessful. Now it had reached a place wherein this man was saying that I don't go outside and do anything with anybody. He wanted his wife to understand that this is just his fantasy, that this is just what he likes doing. But if we told him that you stop it, he was unable to do so. And when he came to me the first time, he was so furious, he was so angry, he was so full of rage. कि इसमें क्या मैं गलत कर रहा हूँ? What wrong am I doing? Why have you brought me to a doctor for this? He was not having insight into his own problem. The major issue here is that he had forgotten that this is a very unhealthy sexual behavior. So the digital medium, because every topic, every case that we'll discuss, we'll see how the digital age is affecting your sexual health. Here what happened was, because he met multiple females on the digital medium, and because he engaged in online sexual intimacy with them, he stopped having intimacy for his wife, and he reached a place wherein it did not even feel abnormal to him. Now, why did this happen? We need to remember one very basic concept about the human brain. The first thing about the human brain is that it really loves novelty. The human brain thrives on novelty. It's like when patients come to us and they say we're having problems with monotony, we tell them that the human brain thrives on novelty. Now here what this guy was getting was, he was getting novelty with every different female. He was getting some newness with every different female. And whenever there is novelty involved, there is the dopamine reward circuit which really gets activated. So as we say, nadia of dopamine start flowing in your brain. And when dopamine flows, then you forget what is right, what is wrong, what is acceptable, what is not acceptable. So in this person, the dopamine novelty cycle overrides his real intimacy. He is not able to understand that, oh, this is what is happening. Now this in medical parlance is called as compulsive sexual behavior disorder. Sometimes he doesn't realize, sometimes he realizes that he is in a problem, but even when he realizes that he is in a problem, he is not able to stop himself. So there is a behavior which continues despite the relationship conflict, despite the impairment, despite the chance that his marriage might break off. And this is not just one case. I am talking about a very extreme case here. Some level of online sexual intimacy outside of relationship, outside of marriage, unfortunately today has become a norm. At least where I practice in Bombay, or where I see a lot of patients from Pune, Sambhaji Nagar, at least in cities it has become common But I'm very sure that even in the most rural parts of our state or our country, to certain extent, this must be happening. We'll go on to the next slide. So now what do we do about it? What did we do about it? And as physicians, what can we do about it? So the first thing, this is called as cognitive behavioral therapy. Basically, what is cognitive behavioral therapy? He has slowly, over a period of time, developed a faulty thought process. The faulty thought process is, I am not going and physically meeting anybody, so it is actually not cheating. I am just virtually engaging in intimacy with people, and that is okay. That is not cheating. So that his basic thought process has gone for a toss. His basic cognition has been compromised. There is a distortion in his cognition. So the first thing that we tried to do, and it took a lot of time, it took at least 2 to 3 months to make him realize that, oh, what I'm doing seems to be wrong. So we tried to replace that cognitive belief wherein he felt that just because physically he's not meeting, it's okay to do it. And once that belief was changed, then his behavior slowly started changing. Second thing, this is also a very real issue today. As general physicians, as gynecologists, I think every day you must be seeing that marriage today is changing faster than ever before. That you have so many options to talk to that you invest very less in your own spouse. So couples therapy is something that we started for them, and we tried to build the emotional connect that was missing between the couple for many years. Once the emotional connect is formed, then rest of the things follow, and then the sexual intimacy, sexual connect automatically comes. The third thing that we did for this person was a total digital detox, at least for a month. Because what happens with addiction, what happens with compulsive sexual behavior is, even if the person initially was, let's say, talking to 10 females, they generally say, doctor, please let me at least talk to one. I will not do anything more than one. But if you give them even a little bit of dopamine kick, they are not able to stop themselves. So you give them one, they will go to 10. You give them 10, they'll go to 100. So a complete, entire cold turkey, zero digital medium for that person for a month. And this was the most difficult part of his journey. But that digital detox helped him realize that real life and real life are different. That virtual sex, that virtual intimacy, even though it is with a real person, he was engaging with multiple woes, multiple females, is nowhere as satisfying as that with your partner in real life. And in many such cases, you have to also screen if there is an underlying psychiatric problem. Many times there is depression or anxiety or ADHD. So as wonderful physicians, what I would advise, if you see anything of this sort, is you screen for depression and anxiety. It's almost always impossible that a sexual disorder like this will happen in a person and he's not having a psychiatric or a psychological underlying pathology. So if we identify that and we treat that, then such compulsive sexual behavior wherein a guy is engaging with multiple women, wherein it is pati, patni, wo, will come back to pati, patni and happiness. So this is the first case wherein we get the basic concept that the human brain drives ahead on novelty, not familiarity. And whenever novelty is offered in an unregulated way, we can lose our way. Moving on to the second case. Sir, I'll please request you to move. Yeah. Now, second case is again very, very interesting. I'm sure we have such esteemed senior people here, such experienced people here, that in your career, you must have seen at least one such case. The case is written HIV anxiety, HIV phobia, but I'd like to describe this case as when Sonakshi Sinha says in the movie Dabang, थप्पड़ से डर नहीं लगता साहब, प्यार से लगता है. So this patient is like, HIV से डर नहीं लगता साहब, HIV होने के डर से डर लगता है. Now what exactly happens in this case? And this unfortunately is very, very, very common clinical presentation. I see one such case every week in my clinic, and I'm sure all of the senior people here must have seen it. So we have a 30-year-old man, he is single, and he has engaged in a protected, entirely protected sexual encounter with he's had a one-night stand. or he's had protected sexual encounter with a commercial sex worker or somebody that he doesn't know very well. Now, after few days, he starts feeling that what if some body fluids were exchanged? He starts feeling, what if I get a STD? He starts feeling, what if I get HIV? And this what if I get HIV becomes the center and the entirety of his entire life. सुबह उठते ही उसे लगता है मुझे HIV होगा, रात में सोने तक he feels maybe I'll get HIV. So what does he do? He goes to his general physician. The general physician hears him out. The general physician says, my dear boy, because you had protected intimacy, you do not need to worry. But if you want to be sure, just do an HIV test. So he goes and does the HIV test. But you know how it is in the digital age. I'm sure all the doctors are witnessing it. After doing the test comes negative. But Google Baba to hai. So that person goes and he starts Googling. Then he says, oh, you have to wait for 45 days definitively to see whether HIV is really there or not. You have to do this antigen test. You have to do that antigen test. You have to do a Western blot test. Only this is confirmative. So the seed of suspicion comes into his head. And what he starts doing is he repeatedly starts doing this HIV test again and again and again and again and again. Every time it comes negative. But his fear persists. He keeps going to a doctor. The doctor reassures him. The doctor tells him, the physician tells him, Beta, you don't need to worry. There is nothing. He feels better for that day. But again, after 2 days, he starts feeling, what if I have HIV? He has a small ulcer. Just today, I had a patient of that sort. He has a small ulcer in his mouth, which is vitamin B12 deficiency. If he's there, HIV ho gaya, HIV ho gaya, HIV ho gaya. So his entire thought process stops. He is living in a survival mode. Now, such kind of patients in medical parlance, 2-3 things are there in this. One, this is called as illness anxiety disorder. So the problem is not that he has HIV. The problem is that when he had sexual intimacy with a person, he started having a preoccupation that he has some serious illness, in this case HIV. 2, there is also OCD involved because he has an obsessional fear. He keeps on going and checking. He keeps on going and testing at multiple labs. He'll go to lab A, he'll go to lab B, he'll go to lab C. He will go to all the labs that are present in the city. He will go to all the physicians who are there in the city. He will go to all the sexologists who are there in the city. And every time when he goes to a doctor, now here is the interesting part. Every time when he's going to a doctor and the doctor is telling him, kuch bhi nahi hai aapko, be rest assured, he feels reassured. But the problem is in anxiety that multiple reassurance helps you feel better that day. उस दिन तो आपको बहुत अच्छा लगेगा. But 2 days later, that anxiety again comes back. And you require more reassurance. You take more reassurance, you feel better again for 2 days. You again want to test it because that anxiety ka mosquito, that anxiety ka insect has come into your head. It's hijacked your brain. So what happens is that the patient starts getting involved totally in this test. Go to doctor, take reassurance, feel better for 2 days, again test. Now, as general physicians, as gynecologists, as medical professionals, what do we need to understand here? The problem with this patient, the key insight in this case is that the problem is the intolerance of uncertainty and not an actual HIV risk. This person has zero HIV risk, all of us know that. But then what is the problem? The problem is that he's not having any symptoms of anything, but he's uncertain. What if that 0.1% something happens? What if I'm that unlucky chap? And he has a very bad equation. He has a very bad relationship with dealing with uncertainty. On a similar front, that is why so many people had mental health issues during COVID. Because COVID was one such illness wherein you didn't know when it is going to end. And as human beings, most of us, including so many of us doctors, have a very, very bad equation with uncertainty. When uncertainty is there, we really don't know what to do. So in this case, the problem was the intolerance of uncertainty and not HIV in itself. So the patient presented with sexual complaints, but actually turned out to be OCD, phobia, and an illness anxiety disorder. Next slide, sir, please. So how do you treat it, and what are the diagnostic clarifications in this? First, this is not a medical problem. It is an anxiety or a OCD problem, and the root cause is intolerance of uncertainty about health. Now, how do you treat it? Generally, what we try and do is no STD treatment required, of course, because there's nothing. You start such patients on SSRI, selective serotonin reuptake inhibitors, which is the first line and miracle medications for such anxiety patients. It works wonders in them. Two, what you do is, and this is very interesting, there's something called as exposure and response prevention. So if I'm having a phobia of HIV, once the medication is started and I'm a little better, what do? As a treating clinician, I take that person to somebody who has HIV and I make that person hold hands with that person of HIV. First, what I do is I expose that person to somebody having HIV, make him sit right next to him. And then he'll get all phobic and then I calm him down. Next step is I make him shake hands. So this is exposing that person to what he's very fearful of, what he's phobic of, and then preventing a response. And then we never allow that patient to go and keep on testing himself for HIV again and again and again and again. Third thing, and here I think general physicians and all of us doctors need to be very, very vigilant, is in such phobia cases, the patient wants reassurance. Doctor Saiba, मला काही होणार नाही ना, मी चांगला राहणार ना, I'll be good ना. He wants that reassurance from us multiple times. Reassurance, when given again and again and again in such cases, is only going to make his case worse, not better. So we need to remember that if it is anxiety, you reassure him once and you tell him, don't seek this reassurance again and again, it will increase your problem. So the second case that we have seen is something presenting as a sexual complaint, turning out to be only anxiety. And this is very, very, very common, especially common with HIV. Why? Because even today, almost 20 to 25 years after massive campaigns were launched against HIV when I was a child, people still have a taboo. People do not have a phobia of cancer because there is no humiliation involved, because there is no social isolation involved. But people even today are fearful of HIV not because they'll die, because today we have such fantastic antiretrovirals. People are living for 20 years after starting HIV treatment. But why are they so phobic of HIV? Because they feel if somebody gets to know, oh, this guy has HIV, that means he is morally corrupt. That means he is morally not upstanding. And that fear of humiliation in society is the reason why people are so anxious, is the reason why people have such phobia of HIV even today. So I think as doctors, we need to be even more sure that when we are treating such patients, we try and reduce the phobia associated with HIV, because today they go on Google and they will type things and they will see what is the latent period, what is the incubation period, what is the period required maximum so that I get a blood test negative and it is 100% sure. So that is the second case. We move on to the third case. Next slide, please, sir, again. We'll move, yeah. So now here we are going to discuss two cases about the most common problem, about the most common thing that is affecting sexual health in the digital age. And that thing goes by the name PORN, porn. We'll discuss two cases related to it. The first case is about problematic pornography use. Now, like every case, the name is problematic pornography use. But again, I'd like to tell you a nice anecdote. Salman Khan in his movie said, एक बार मैंने commitment कर दी तो फिर मैं अपने आप की भी नहीं सुनता. Now somebody with problematic pornographic use says, एक बार मैंने porn use करना शुरू कर दिया तो फिर मैं अपने आप की भी नहीं सुनता. And in this one sentence lies the entire essence of the problem. So multiple times we have cases wherein let me discuss one specific case. A 25-year-old software engineer in a very huge company, something like Microsoft or Infosys or TCS, let's say, doing very well in his career, but he had a breakup 1 year back. Now, after this breakup 1 year back, he started engaging in pornography. His friend told him, यार इतना बोर क्यों होता है? थोड़ा porn देख लिया कर, थोड़ा blue film देख लिया कर, which he had engaged in before, but it was very, very sparse. But now what he's doing is, now he starts engaging in that in whenever he gets free time. Now, before he knows it, in a few months' time, he came to me with the complaints, not I'm using pornography too much. He says, doctor, I am not able to focus on my work. I was a star performer in my organization 6 months back, and now they have put me on PIP. PIP in corporate says now the step before they'll remove you. So from being a star performer, this guy has come on PIP. PIP is pull up your socks, otherwise we are going to remove you. हम आपको निकाल देंगे. And I took a detailed history, and then there was a lot of hesitation. But finally I told him, I figured there might be some problem here. I said, yaar, my dear, I was also 25 once. Jawani हमने भी देखी है. I also know what you must be thinking. Do you watch a lot of porn? And then he opened up. And then he's like, doctor, every day 5 to 7 hours of pornography is what I am doing. I love it. I know it is bad for me, but I can't seem to stop. It's like the brake button of my car has failed. I don't know what to do. I sleep less. I work less. There are some beautiful, talented girls in my office who approach me, but I don't want to talk to them. All I want to do is engage in watching pornography. Now, this case is again very similar to case number 1. In case number 1, where it was Pati Patni and wo, the person was engaging in real mobile-based intimacy with multiple females, but at least the females were real. Here, he is watching whatever he wants to in pornography. He is every day watching a different porn video, and the level of dopamine kick that he is getting is not matchable by anything else in his job. Girls are approaching him, beautiful, talented girls are approaching him, but he seems to be like, no, I'm not, I just want to do this. And finally, when he came to me, he came not because it was a porn addiction. He was not able to identify it as a porn addiction. He came because his work was really getting affected and he was about to be thrown out of his job. So here I want to discuss about problematic pornography use, or something called as porn addiction, for which we say, din dugna raat chaugna. Unfortunately today, porn addiction, I would say, din dugna raat chaugna, the number of cases of this is happening. You look at, and unfortunately it's very more in males. You look at 100 males around you, at least 10, and the statistics say, and I also feel the same based on my practice, at least 10 must be having some level of porn addiction. Now, how do we decide whether it is porn addiction or it is just normal porn use, which most of the people do? So there are 2-3 things which as physicians we need to remember. If we want to define that as porn addiction, like in this case, there are 3 things. First, there is something called as withdrawal when the person does not watch porn. So let's say this guy has a very important meeting in office and he has to stay in office for 12 hours. And he does not get to watch porn that night. He will start feeling irritated. He will start getting restless. He will not be able to focus on his work. So he will start having withdrawal symptoms like people of alcohol have, like people who smoke cigarettes have. So let's say an alcoholic doesn't have alcohol for 1 day, he won't sleep, he'll have tremors of hand. Similarly, there are a lot of psychological withdrawal symptoms that these people experience. So withdrawal is the number 1 thing. If you're looking at someone who's saying, oh, I overuse porn, and you're thinking maybe it could be porn addiction. So first is the withdrawal, psychological disturbances. 2, tolerance. Tolerance is like again with alcohol. पहले तो मेरे को इतनी सी चढ़ जाती थी, फिर मुझे एक पहले मुझे एक पेग चढ़ जाता था, फिर मुझे आधी बोतल चाहिए थी, अब मुझे पूरा एक खंबा चाहिए. And unfortunately, our doctor community is also very leading the front when it comes to alcohol. So all of you know what I'm talking about. Even in porn addiction, what happens is he'll tell you, Dr. Sahaba, pehle I used to watch it for half an hour. At the end of the day, I used to feel relaxed. Then I needed to watch it for 2 hours, then 4 hours, and it never stops. It just keeps on increasing. So you become tolerant to that level of stimulation. You want more stimulation, you want more graphic stimulation, you want different types of sexual intimacy. So that is the second thing. First was withdrawal, second was your tolerance, and third was it is leading to socio-occupational impairment, which it does in such a case. So this 25-year-old had all the three criterion, and if you see anything of that sort in your practice, then it is a proper case of porn addiction, wherein that person has lost control, so to say, over his brake button, has the prefrontal cortex has lost control, and he is now acting impulsively. Now, what did we do for this case, and what can we do if we get such a case? First, motivational interview. Try and understand from him whether he is motivated to change all of this or not. Try and understand from him whether he realizes that the problem is not मेरा job जाने वाला है. The problem is why मेरा job जाने वाला है and how I am engaging in this level of digital addiction. 2, as we did in the first case, identify what are the triggers. Is it stress? Is it the stress of job that he's trying to cope up somehow with porn? Is it boredom that after 6 p.m. I have nothing to do? कुछ है ही नहीं काम करने को तो क्या करूं मैं? Might as well watch porn. तो boredom अगर है तो you have to find a strategy for that. Is it loneliness? Many people in big cities like Mumbai, Pune, Nagpur, Sambhajinagar, many people, Bangalore, people are staying away from their homes. People are staying alone. They feel lonely. And to tackle that loneliness, what these people are doing? These people are engaging in porn. So if any of these triggers are there, identify and try and change it. Digital detox, as we did in the first case. Sleep hygiene. In this specific case, sleep hygiene was important because he was watching porn from late evening to early morning. So initially we gave that person some zolpidem, we gave that person some melatonin to try and get his diurnal cycle back on track. Address the underlying depression or anxiety, and certain lifestyle change like exercising, social engagement, hobbies. Replace that porn time with something that is enjoyable. Now this is again very key concept. Many times what happens is he's really liking that porn. He knows it's bad, but he's liking it. So that is giving him a lot of pleasure. Now, if you stop that and you replace it with work, or if you stop that and you replace it with something that is not pleasurable at all, he will not do it. It is like when we have a diabetic patient coming to us and we tell him ki काका तुम्हाला साखर बंद करायला लागेल, but sugar free घेऊ शकता. The chances that that guy will listen are much higher than when we tell him ki काका तुम्हाला साखर बंद करायला लागेल and you can't have anything meeta, not even sugar free. The chances that he'll follow are lesser. So here also, that porn is giving him a lot of stimulation. That porn is giving him a lot of pleasure, dopamine. If we replace it with zero dopamine work, he's not going to get better and he's not going to be able to follow up. So we have to try and replace that with hobbies. So how do you know what his hobbies are? Just ask him when you were a teenager, before you started watching porn, what was it that gave you true joy? Was it football? Was it cricket? Was it music? Was it video games? What was it that really made you have a good time as a teenager before porn started? And replace the porn time with that. So more pleasurable thing with not zero pleasure, but some level of pleasure. That is how it works. So as a physician, if you get such a case, please remember, it is not how much porn he is watching, it is not how many hours he is watching, it is whether his functionality is getting compromised. So not the frequency of porn watching, but the functionality. If it is getting compromised, then we need to please take care of it. Let's move on to the next case. So this was, एक बार मैंने commitment कर दी तो मैं अपने आप की भी नहीं सुनता. एक बार मैंने porn देख लिया तो अपने आप की भी नहीं सुनता. But yes, with correct medications आप सुन सकते हैं. Now the fourth case. This is also related to porn, and this is again very interesting as a psychiatrist, as a sexologist, even as gynecologist, even as physician, I'm sure you must have seen at least one such case. This is about a 20-year-old male who always keeps asking the question, मैं ऐसा क्यों हूँ, मैं ऐसा क्यों हूँ. Hrithik Roshan asked that in the movie Laksh, कि मैं ऐसा क्यों हूँ, मैं वैसा क्यों हूँ. This guy also keeps asking, मैं ऐसा क्यों हूँ, मैं ऐसा क्यों हूँ, मैं ऐसा क्यों हूँ, मैं वैसा क्यों हूँ. But ये किस बारे में पूछा है ऐसा? He is asking about his penis size. He is asking these concerns about his sexual stamina. Okay, so this 20-year-old male, he came to me about 6 months back, and his primary complaints were two. He was like, doctor, I have a partner of 3 years and we engage in regular sexual intimacy. But I feel that my penis size is too small, and two, I feel that my stamina, my intimacy doesn't last long. I feel it gets over very fast. Now I asked him, what is your size? He gave me a specific number, which is the average Indian size. I asked him, how much is your stamina? He told me the actual peno-vaginal intimacy lasts for about 15 to 20 minutes. And I was in my mind happy that he is all normal. But then I asked him, why do you feel that you are having less stamina, and why do you feel that your size is less? Again, the trigger in such a case is, what he told me was, I have watched so many videos, sir, there the size is so much and there the stamina is also so much. So what was the trigger in his case? That pornography compares and makes you have unrealistic standards which nobody can match. And pornography is doing this at a big scale. We discuss porn addiction, but this is something different. Here, it is absolutely changing your image in your head of what is normal, what is abnormal. So here you have a guy with a normal penis size, here you have a guy with a normal sexual intimacy time, but still he feels that he is very, very poor in it. Initially, when I tried to tell him, and this is something that I've encountered with most of the patients, initially when you try to tell them that it is normal, there's nothing wrong with you, they don't want to listen to you. उनको लगता है नहीं, it's not that way. I saw in that movie. Then what you have to do, and this has helped me, is I give them examples of violent movies. I tell them RRR देखा है क्या? I tell them KGF देखा है क्या? I tell them Dhurandhar देखा है क्या? And they say yes. And then I ask them, RRR में how one person is beating up 100 people, is it really possible? They'll say no. So then we explain them that like RRR is a movie, like KGF is a movie where there is an over-exaggeration of what normal violence is. You're glorifying it. Pornography is also a movie like those movies wherein the sexual part is over-glorified, it is over-amplified, and it is just to give you more dopamine kick. That is when most of them realize that, okay, maybe I am looking at it wrong. Maybe there is no real problem. So we need to understand one thing, that most of the time, men coming with the issue that my size is very less, that my stamina is very less, most of the times, at least 50% of the times I feel, they do not require a penile enlargement. They do not require a penile implant. All they require is reassurance about their size, reassurance about how well they are performing, and clearing their doubts. Doubts created by the intelligent angles of the camera of porn. So we need to remember this, because this is something that really is very, very common. Now, what started happening with this specific individual, the 20-year-old male who came to me, was he had started avoiding intimacy with his girlfriend. He had started avoiding meeting her because he felt that she is not enjoying the sexual intimacy at all. He felt that she feels he is not worthy of him. And when we spoke to the girlfriend, and in such cases we must do that, For the second session, we called the girlfriend and we asked her how happy she was with their sexual life. She was very happy. So many times in such cases wherein there is an anxiety about your body image, wherein there is an anxiety about your penis size, wherein there is an anxiety about how well you are performing, if you just call the partner and you make the partner speak in front of the patient and the partner says, oh, I feel it's all good, if he had just told me, that one act is more powerful than any other medication can be. The amount of anxiety relief, the amount of performance anxiety that evaporates when your partner says that is more than any pill, is more than any anxiolytic can do. So from this case, we also, one more thing, whenever you have somebody who has a body image about his or her sexual organs which is very bad, and this is seen not only in boys, it is also very commonly seen in girls. Unfortunately, Gen Z girls who are around 15 to 20, 25 today, so many of them, they come to plastic surgeons, and then the plastic surgeons, sometimes they refer to us. They have very, very abnormal expectations about their breast size. They have very, very abnormal expectations about how their vagina should look. And even though they are perfectly healthy, even though all the hormones are in place, even though their secondary sexual characteristics are all in place, they still are under the concept that they need to have bigger breasts. They still feel their vagina needs to look a specific way, their vulva needs to look a specific way. So I think if we have somebody like that, it also indicates that that person is very low on self-esteem. Somebody who has very high self-esteem, somebody who has high self-confidence, somebody who thinks, oh, I am Dhurandhar, will generally not have anxiety about their body image. They will feel, I am the best. They will feel, I am the king. They will feel, I am the queen. But somebody who primarily has an anxiety problem, somebody who has low self-esteem, somebody who looks in the mirror and says कि यार मैं इतनी सुंदर नहीं दिखती, somebody who looks in the mirror and says कि यार मैं इतना handsome नहीं हूँ, that person will more or less generally have some anxiety about their sexual organ and their sexual prowess also. So if you feel that somebody is coming to you with that, it is important to assess कि उनका self-esteem कम तो नहीं है. Are they living in shame? Are they living in depression? And such patients many times require a lot of counseling. So from this case, we have a key clinical insight that 85% of men with penis size concerns have actually normal and fantastic anatomy. Pornography creates unrealistic expectations. Why? Because they will take actors whose penile size is inherently high. So they will select somebody, there is a selection bias. They will select somebody who naturally has a bigger penis size. The camera angles are such that a small thing will appear big. The editing is such that if it is shot in 10 times, it will appear that it's done in one go. And therefore, this is not a medical problem, but a body image disorder. And this is something which is very, very common both in males and also in females. So as a general physician, as a gynec, what can you ask these people? How is this affecting your relationship and sexual confidence? Are you avoiding intimacy because of this worry? And have you compared yourself to pornography or other men? If the answer to any of this is yes, they require some intervention. So will please go on to the next slide. All right, so what is the treatment for such cases? Again, psychoeducation, explain them normal anatomy, explain them the variation in normal anatomy, explain them how porn gives you a distorted image, teach them mindfulness techniques so that they are more engaged on enjoying themselves while they're having sexual activity rather than performing. This is also one very important thing that is happening a lot in youngsters or anybody these days, starting to think of sexual activity as a performance. Like you go and speak in front of 100 people, that is a performance. Sexual activity is not a performance. It is one of the most basic desires that God has blessed us with. So it is something that will come naturally to you. But the more you start thinking of it as a performance, as an event, as a task, as something that needs to be completed, that something needs to be done in a fantastic way, whenever you look at that as a performance anxiety will come. If you look at it as a natural act, as a let's go with the flow act, the chances are higher that it will automatically happen. And in such cases, sometimes relationship counseling, as I mentioned before, is something that we really need to pay attention to. So this case was मैं ऐसा क्यों हूँ, मैं वैसा क्यों हूँ. We have discussed 2 porn related cases. First was एक बार मैंने commitment कर दी तो मैं अपने आप की नहीं सुनता, तो मैंने एक बार porn देख लिया तो मैं देखते ही रहता हूँ, अपने आप की भी नहीं सुनता. Second case was मैं ऐसा क्यों हूँ, मैं वैसा क्यों हूँ, मेरा लिंग ऐसा क्यों है, मेरा लिंग वैसा क्यों है. Most of the times it is just body image distortion. We'll go on to the next slide and the next case. I think this is the last case. Next case, next slide, sir, please again. All right. Now this is the most interesting case, and I did not think that I will see something like this, but I have seen 2 such cases. Very interesting. For most of the people who are watching porn, tech is giving them maza. But in this case, tech gave them saza. What was the saza? Erectile dysfunction. And this is psychogenic erectile dysfunction. Psychogenic erectile dysfunction means actually there is nothing wrong with that guy. There is no problem with that person. It is just that his mind is playing tricks on him and he feels he has an issue of ED. Now what happened in this specific case? Please do listen very carefully. I did not think that we'd have such a case in India, but we do have. So 20-year-old male, or let's say 20 to 25-year-old male, he came to us saying that I am not able to perform with my partner and I am having a ED problem. We said, okay. We asked him, do you get your early morning erections? He said, yes. We said, do you have any medical problems which is diagnosed? He said, no. We tried to rule out every organic cause and every organic cause was ruled out. We tried to understand if there is anything problem. We did a Doppler for him. The Doppler came out to be normal. But at the end, after 2 sessions of all reports coming normal, he tells me that doctor, main na, and he did not bring his partner that specific time. And he's like, doctor, main na बहुत sexual fantasies पे act करता हूँ. So I was like, what sexual fantasies you act on? I thought maybe he must be watching porn or doing something like that. But his sexual fantasy was very different. He said, I use a lot of sex toys. So I was like, okay, many people are using masturbators, many people are using dildos, many people are using something to enhance their pleasure. It's okay. But he said, no, I'm not just using this much. I am using AI. AI has come everywhere. This is proof that AI has come everywhere. I am using AI-based sex dolls. Now I'll first explain what are AI-based sex dolls, because when I got to know it about the first time, I also didn't know ऐसा कुछ होता है. And I'm sure, you know, everybody who hears this, पूरे कान खड़े हो जाते एकदम, अरे AI sex doll क्या है? So what is it? I'll try and make you understand first, because I also didn't know about it. So you get at a very highly priced, at a very high price point, you get silicone dolls which are entirely structured in the shape of a human body, which have got certain calibrations in them, wherein if somebody is having, let's say, intimacy, penovaginal intimacy, they've got all the orifices which a normal person would have. Let's say a guy is having intimacy with them. The intimacy that he has is almost the replica of what one would have in real life. So there are contractions of the vagina artificially that is created. The person, the sex doll can be fine-tuned to such an extent that when you're having intimacy with that sex doll, there will be movements, there will be vibratory movements, there will be jerky movements similar to the ones that one experiences when one has intimacy. So it will feel real. On top of that, it will be to such an extent that if it has also got a voice command in it, it will be to such an extent that if you customize it, and you do get that level of customization, it will also moan for you, it will also scream for you, and it will call out your name. So that level of closeness to what real life intimacy can feel like. And that is what this guy had been doing for the past 6 months. Now the problem was, he started enjoying only that, And with his partner, he was not enjoying intimacy because, of course, the AI doll has various modes. And the AI doll, like ChatGPT, I don't know if any of you have done, but आप ChatGPT को बोलो कि this is what I did. ChatGPT will always console you. It will never happen that ChatGPT will tell you that you said, oh, I did this horrible thing today, and ChatGPT will say, yes, you did a very horrible thing, you should be punished. That AI sex doll is also designed in a way that it is very submissive and it will listen to all of your sexual desires, which is impossible with a real partner, because the real partner will have her mood swings. A real partner will sometimes feel really energetic. A real partner will not feel that sometimes. So the person starts enjoying intimacy with that AI doll so much that when he's trying to have intimacy with his girlfriend, he is not able to get an erection. He is not able to perform. Either he doesn't get an erection, or if he gets an erection, by the time he is trying to consummate the relationship, he again has flaccidity in his penis. Now, what is the mechanism behind this? Very interesting, but what is the mechanism behind it? The brain has been conditioned, and the brain has now adapted to artificial stimuli. Visual stimuli, tactile stimuli, touch-based stimuli, novelty-based stimuli. So now in these sex dolls, what happens is you can also do role play with them. So you can say, oh, I'm the boss, you're the secretary, that level of customization. So that level of novelty starts getting introduced every time you're having intimacy. 1. 2, performance anxiety. The sex doll is not a real object. So you have really no performance anxiety while you're performing with that piece of silicone. But when you try and have intimacy with your partner, there is a fear of failure. Oh, what if I lose my erection? So that performance anxiety creeps in. 3rd thing, reduce sensitivity to real life partner. Because with the sex doll, you are getting intense level of stimulation. And 4th thing, the relationship anxiety. What will my girlfriend think if she gets to know about this? How will my girlfriend react if I'm not able to perform well in bed? She will think I am less of a man. So, AI, tech, sex dolls, all combined are inducing this erectile dysfunction in this specific person. We'll go on to the next slide, see what did we do about it and what can we do about it. First, you have to psychoeducate the patient, like in all the cases, because here digital medium is involved. Here there is some level of mind involvement. You have to psychoeducate the patient that this is how your conditioning is happening. A very simple example is, let's say, and this is just for the purpose of understanding, let's say I have, let's say my favorite food is pav bhaji. On one hand, I am given the option ki you eat pav bhaji, but you have to eat pav bhaji 365 days a year. On the other hand, I have the option of eating pav bhaji once a week, and on the other 6 days I can eat biryani, I can eat dal bati, I can eat junka bhakri, I can eat samosa. I will always choose the second option. Even though pav bhaji is my favorite food, I will still choose the second option, wherein I am getting different food every day, because brain wants novelty. Now this is what you have to explain to that patient. If he is getting novelty as far as the sexual experiences are concerned with the artificial intelligence, he will find the real thing boring. So then how do you change it? We train the patient in bringing novelty into their real sex life. How do you do that? First thing, and this is again something which most of the couples don't do, blindfold the patient that is having the problem. The problem with most of the patients is that as humans, we are primarily visual creatures. At least males are primarily visual creatures. So what happens is, when they're having intimacy with the same partner again and again and again, there is less dopamine kick every time they do it. But if you just blindfold them, what you're doing is you're letting the other 4 senses really get stimulated. And then the same partner with which he was not getting excited, he will feel excitation, because the same touch will now feel new, because he will be able to smell his partner better. He will be able to, they can talk in a specific way, as we say, dirty talk or erotic talk. So use the 4 senses which are generally not used very much. That is how you can bring novelty. 2, you can bring novelty by doing role play. So this patient only we told ki you do role play with your girlfriend. What kind of role play? You become the boss, let her become the secretary. You pretend that you guys met in a cafe and you wooed her. So the brain requires some level of illusion so that it feels that dopamine. So role play is something that can really help. So first we tell them that this is why your brain is doing so. We give them some behavioral intervention. Third is, many times we also give these patients as a bridge treatment till they get better. We give them PDE5 inhibitors like tadalafil and sildenafil. Sildenafil we generally don't give. In 99% of the times give tadalafil. We give a microdosing of tadalafil 2.5 milligram daily, because even if he is having some anxiety, but the tadalafil is there, he'll be somehow able to sustain the erection. He'll be somehow able to have intimacy with his girlfriend. And once he does that 1, 2, 3 times, his confidence will skyrocket. He'll be like, I'm the king. He'll be like, yes, my mojo is back. He'll be like, yes, main abhi kar sakta hu. So just because we want to get the confidence back, we are giving an additional support for some time with PDE5 inhibitors, although there is no organic problem, although there is only psychogenic erectile dysfunction. So this is something that we need to remember. The pearl here for our wonderful physicians is that this is not a vascular or hormonal problem, it's behavioral conditioning. So we have to reverse condition them. And if we do that early on, prognosis is really beautiful. In 3 to 6 months, we see that all of this thing with artificial intelligence really reduces and the person starts enjoying real intimacy a lot more. So these were the 5 cases which I felt will give us a very different perspective as to how the digital age is contributing to sexual health and all of its problems. If and only if we have more time, that case is not there here, but I'd like to share it. I'll ask Dr. Madan Kamleji with his permission. If it is possible, I'd like to share. If not, then no worries. If there is time.
You can share, sir.
Okay. So this is again very interesting case, and this I want all of the gynacs, especially, of course everybody, but I want all the gynacs who are attending, all the wonderful gynacs who are attending, please, this is my Vinamra Nivedan, that this case is something that every gynac must have seen sometime in her life. If your connection with your young patient, especially a teenage patient who's just had a periods, who just started having a periods, a menage, is there, happens all too commonly. I have myself in my life seen at least 15 to 20 such cases. Now, what is this case? I'll give you a typical presentation. A 15 to 20-year-old or a 15 to 25-year-old female. 15 to 25-year-old female who, like most of the girls today, because we are talking of sexual health in digital era, who, like most of the girls today, are on some or the other dating app. It could be Tinder, it could be Bumble, it could be anything. So you have that 20-year-old, she's on some dating app. Why she's on the dating app? Because she just had a breakup, and breakups are very common these days in Gen Zs. We know that they are in situationships, they are in very small relationships, very small in the time frame. So she's just had a breakup, and she, just to feel a little better mentally, is trying to go on a dating app and talk to someone. Now she matches with a 30-year-old person, and that person starts talking very nicely to her. That person starts talking nicely to her. She tells her her sad story, that this is what happened, my previous boyfriend was this way, and this is what he did, and how he cheated on me, and I am really in a bad place now. So initially this 30-year-old provides a lot of emotional support, emotional comfort to her. Slowly she starts relying on this guy. She feels, finally, आखिर में मुझे मेरा शाहरुख खान, जो दिलवाले दुल्हनिया वाला है, जो मोहब्बतें वाला है, उस टाइप का मुझे मेरा राजकुमार मिल गया. And the moment she realizes that, she totally and blindly trusts this person. Now what this person starts doing, I'm not saying every man is like that or every person on a digital app is like that, but in this specific case, what this person starts doing, he starts engaging in sexting with her. Now she feels, okay, I'm in a relationship with him, so might as well sext, share erotic messages. It goes ahead. He starts asking her to share compromisable nude or naked pictures of her in different poses. Initially, she is reluctant, but here the manipulation starts. Now she is emotionally dependent on that person. He says, तुम मुझ पे इतना भी भरोसा नहीं करती. You don't trust me at all. In your bad phase, I was the one who helped you, na? Do you think I can do anything bad to you? I just want to see how beautiful you are. And this emotionally vulnerable girl, she starts sending nude photos of herself. This goes on for some time. After some time, what happens is this guy starts giving less and less attention to this girl. She gets restless. One fine day, he says, come and meet me here. We will meet here. And it is time we took our relationship to the next level. So she says, what does next level mean? So he says, next level means now we have to get intimate. We have to enjoy with each other. The girl says, no, I'm not comfortable with that. I have not even met you in my real life. We have just been talking on the phone. I've been sexting you. All that is fine. But real mein kahan milenge hum? I'm not okay with this. Now here the real extortion starts. And in psychological terms, there is in fact a term for this. Using sex for extortion, it is called as sextortion. So what this guy says, I will leak your photos on the internet. I will do this. I will send these photos. I will send these videos to your parents. I will send it in your family group. And unfortunately, some of the females fall prey to this. They go and meet the person. They engage in a forced intimacy. The person is so manipulative, he will record that also. And the next time the girl wants to come out of it, he will use that video also to blackmail her. And this is not one-off. I myself have seen at least 15-20 such cases in the last 5 years. So sextortion, wherein you are emotionally taking someone in, making them dependent on you, then extracting sexual information from them, and without having a pure intent, with all the malignancy that one can have in their intent, using that for sexual intimacy, for sexual intimacy, is something that is all too common today. So I request all our wonderful gynacs and all our physicians, gynacs more so because a girl generally starts having their gynac just after they have started having their periods. So there is a basic bond between the gynac and that girl. Please do make them aware, because many times parents don't even know something like this happens. Parents are not comfortable sharing this. If every gynac starts doing this and starts telling the girl ki beta asa hoऊ शकतं, I know you are very strong, but something like this can happen. मला माहिती आहे तू खूप विवेकी आहे, पण असं घडतं. Just letting them know that something like this can happen, I think will go a long way in stopping this sextortion, which has become all too common. So this was one case which I forgot to include in the slides, but I really wanted to share. And yeah, the last take-home message from my side would be, when does a general physician or a gynac refer to a sexologist, or somebody like me who's a psychiatrist and a sexologist? 5-6 simple things. Whenever you feel that the person is engaging in sexual behavior wherein he or her is losing control over herself, wherein her relationship or his relationship with his family, with his spouse is going bad, wherein if he is not engaging in that sexual behavior, digital based sexual behavior, he's getting very irritated, he's getting aag babula, he's having anger outbursts, he can't concentrate on anything. And also one more case wherein the person is unnecessarily having doubts about his sexuality, about his or her sexual organs, about his or her secondary sexual characteristics. You feel everything is fine, but still that person is again and again coming to you and saying, Dr. Saab, there seems to be a problem. That is the time when हम मेंटोस खाएंगे, दिमाग की बत्ती जलाएंगे, and psychiatrist or sexologist के पास preferably इस patient को भेजेंगे. On that note, I think I've spoken a lot continuously. I'll take a pause and I'll hand over to Dr. Kamblesar ji. If there are any questions, I would like to share my insights if we want to have any discussion of any sort.
Sir, it was really an exhaustive lecture, fantastic informative, educational, everything.
And so
way
the
you
anecdotes
speak
that you have
and
used,
yes,
the movies, things and everything, I think it is so much relatable and understandable and with a lot of humor.
Thank you.
fantastic speaker you are. Everything you
So
have
we
told.
have some questions from the audience.
Okay.
Madan
So,
sir, can I please go ahead
Yes,
with it?
yes, Parul.
Yes. So there's a first question which one of the delegates has asked is, how has social media influenced young people's understanding and expectations of sex and relationships?
yeah, so as we discussed, social media has unfortunately totally distorted it to an extent wherein now people feel that you need to have sexual intimacy. In fact, we get so many cases because on social media they are seeing that, oh, this girl has a boyfriend now, or this girl has gone out with that boy now. That girl is staying Sat Samundar Par somewhere in the US or somewhere else, but this girl, let's say, sitting in some corner of rural Maharashtra, let's say somewhere in Ambezogai or somewhere in Bhandara or somewhere in Chandrapur or somewhere in Mumbai. She is looking at a girl in a different culture, let's say USA or Spain, seeing, oh, she's so sexually active and she's posting all of this. That means I also need to get active. She's creating additional pressure on herself to match the standards, which is very unnecessary, which is totally out of context as far as the culture is concerned. So that is one thing which social media is automatically doing. Two, as we discussed, I discussed about porn, but social media is doing this, and this social media is doing unfortunately more to females. We didn't discuss that in great details. Social media is totally altering the body image that females, that young, beautiful, pretty girls have about themselves. We see so many cases wherein a beautiful girl is walking into a clinic and telling somebody like me or maybe like you, I don't look beautiful. I want to get this surgery done. I want to get liposuction done. I want to get fillers done. I want lips like this. I want Korean skin. I want that. And we ask why. Otherwise, I want breast augmentation done. Why? Because my boyfriend will not like it. Whether the boyfriend really wants it or not is a different thing. And what we say in such cases, one, does your boyfriend want it? She says no. Then we say, then why are you putting yourself under pressure based on social media? Two, if your boyfriend says yes, then what we recommend is change the boyfriend. Because as a boyfriend who is not accepting you for who you are, tomorrow he'll tell you 10 different things. So you change the boyfriend. But this again, there is.
Do they accept this changing the boyfriend, or they are mentally too inclined towards them?
No, one good, I don't know what to say. One good thing or bad thing about Gen Z, what I see at least here in Mumbai, is that many times they are not very over emotionally involved. Now that because of that, the relationships also don't last long. But because of that, if you have a toxic pattern in your partner, that can also easily break because you're not over invested. Because it's like you're a partial agonist, you can come out easily. If you're a full agonist, then you'll attach more. So it's like that.
Yes. Okay, sir. Thank you so much, sir.
Thank you.
There is one more question, that how can individuals protect their privacy and practice safe consent while sexting or using dating apps?
Yeah. So while sexting, first of all, sexting should only and only start when there is a basic amount of emotional stability in the relationship, when there is a basic level of trust in the relationship. So it should always be that the trust comes in the relationship, and once the trust comes, then the sexting should start. Today, what happens, at least in Gen Z's youngsters, is ulta. The relationship starts with the physical part. They go ahead with the physical part. Sexting is just the initiation of it. They go ahead with the physical part, and after the physical part is over, then they think, oh, am I emotionally inclined to this person or not? So it is exactly opposite of descending order matters going on. So first, establish whether there is basic trust, basic emotional connection, basic value alignment or not. If that is there, then two, you go to sexting. But when you go to sexting, you sext on a platform which is, let's say, encrypted. Like when we do WhatsApp chats, they are encrypted. Now they're secure. So maybe WhatsApp is one good medium. Then what you do, you ensure that even if you are sexting or if you are sending photos, do not ever send a photo wherein your identity will get revealed. So if you trust the other person a lot and you are sexting and you are sending photos, this has to be a no negotiable. Never ever share your face, because once the person shares the face, what happens is most of the cases is not that the other person wants to manipulate you, but if things go wrong in the relationship and the other person feels betrayed, then he or she will use that against you. So it's not that all couples start out that way. It's like if the relationship goes sour, then the other person feels, acha, मेरे साथ betrayal हुआ है, मेरे साथ ये हुआ है, now let me teach this person a lesson. So please don't share your face. One more thing what you can do is you can create boundaries as to what level of sexting you are comfortable with, and if it is going into a unsafe or a area which you are not comfortable with, both of you have a mutually decided safe word, and you type that safe word, and whenever that safe word is typed, then no questions asked, the sexting will stop. So if you do that, I think it can still be done in a decent way. But yes, the emotional connection has to happen first and then all of this, rather than the other way around.
One more question, sir. I think last question. So they say that there is a lot of people, influencers, so called on Gram. There are a lot of them. So should Gen Z or the millennials or whatever the alpha beta generations which are coming in, so should they seek any kind of sexual health advice
Not
from
at all.
these so-called influencers or social media platforms? Like many of them are not even doctors, or maybe they're not trained enough to probably speak about those topics, but we see it's not regulated in India. Like
Yeah.
for China they have
Yeah,
now
that's
made
what I was
some
about to say.
regulations,
Yeah,
but
yeah.
in India it's still not regulated.
Absolutely. So, ma'am, you have hit the nail on the head. As you said, I was going to say that only. Ki China mein they have banned any, let's say, non-technical person talking about a specific technical aspect. So, let's say a non-doctor talking about medical science, or a non-engineer talking about how engineering works, or a non-CA talking about income tax. That is something that they have banned in China. Unfortunately, अपने यहाँ पे अभी तक हुआ नहीं है. But I think that is why there was if you go on the Instagram, many doctors also today are putting out reels, and then there was one reel which became very famous of all the doctors, which was you are a doctor, why are you posting content, why are you becoming an
Yes, sir.
influencer? And
Why
then
you
the
becoming
doctor
an influencer?
says,
Because
the doctor says, because
influencers are
influencers
becoming
are becoming
doctors.
doctor.
Yeah.
What do you do? So I think one thing that we need to do as doctors is we need to reach out more to the common public. We need to create content again related to our field. So let's say I'm a psychiatrist or a sexologist, I stick to my thing. I shouldn't go and start talking about orthopedics. That is also something which we have so many doctors also who are from a different specialty talking about a different specialty. That is also because you're not seeing it on a daily basis. No? So bilkul nahi. So if we are advocating ki I talk about my specific field of expertise, it is without question, there is no doubt that somebody who doesn't have expertise in that, even if they have so-called expertise but they do not have the degree in that, then these people should not be followed by the common Gen Z. There's no question about that, because then it creates so much of myth. Like if you just, when we're talking of sexual health, if you just go on YouTube, you go on Instagram, and you just put it on YouTube and Instagram, is masturbation natural or abnormal? You will have 10 videos, everybody saying different. Everybody. And doctors are fighting with each other. Some doctors who are, so-called doctors or quacks, who do not understand the mechanics of it, are saying, oh, it's very healthy, just keep on doing it, without saying when to do it, how much to do it, what is the circumstance, when to stop, when to identify if it is masturbation addiction. So definitely, I am of a very clear view that all of us, our doctor community, has to be very strong in doing that on Instagram or social media. And the Gen Z has to be smart enough ki if a doctor is talking about, oh, this is how you need to save your taxes, don't listen to us. But if a non-doctor is talking about, oh, this is how you can fix your sex life because I fixed it this way, then that is just empirical evidence. Na? That is not RCT nahi hua hai. There's nothing, there's no randomized control trial. It's like, oh, I treated this patient with this, and I feel that is the way it should be for everyone. So it's just empirical.
But sir, ironically, these are the people who will have the maximum followers also.
Yeah, that is why Modi ji also had to come on Instagram to talk about the NEET protest. Now, what to do? Yeah, but see, it is. I think what matlab, this is just a very different topic. But my personal opinion is, we as doctors need to be better engagers.
Yeah.
We have so much of information, we have so much of knowledge, but the medium of engagement, how powerful that is. It's about who can spike your dopamine the most today. So if we put out content which gives a dopamine spike to the Gen Z, they'll listen to us.
True.
Yeah.
Yes, Kiran
Thank
madam.
you so much, sir. It was very insightful.
Thank
Kiran
you.
madam,
Thank you so much.
we would like to have your inputs.
Ma'am, you're muted. Kiran ma'am, please unmute yourself.
Yes. Yes, actually, it was very interesting and very informative lecture delivered by Dr. Sagar. And we also come very commonly as a gynecologist, we come also across such patients. I remember one patient, she was having complaints with lady, married, mother of 2 children. For some reason, she was residing at Pune for her some business purpose. She was doing up and down from Solapur to Pune, and she had complaint of female masturbation. Very commonly, she said, while I am in room, though my husband is satisfying me, I want to do masturbation.
Nymphomaniac, yeah.
So I advised a very simple thing. I said, don't remain alone. Be in company, and whenever you have some feeling like that, just come out of room and mix with your friends and all that.
Right.
So I don't know any medicine, but I just give advice like that.
Right.
So you have delivered so many things, very, very informative and very nice lectures. Really a big thank to Dr. Sagar.
Thank you.
Yeah.
Thank you.
And Dr. Madan has chosen very proper person, and he waited for you. That was the very right decision of him.
Correct. Dr. Madanji, he reached out to me in May. I was out of India and I felt so bad because Dr. Rajan Bhosle sir had referred me, I guess. So I was like, यार इतने experienced व्यक्ति को मैं नहीं बोल रहा हूँ, because I was having a trip with my family. I was not in that mindset. So I just like to be in that mindset. So I give 100%. But I'm so grateful to Dr. Madan Kamble sir also, कि he again reached out. I'm very grateful to all the esteemed audience, because I think most of the audience, most of the doctors here are much more experienced to me. But you very, very diligently listened. I'm again very grateful for that also.
Yes, thank you so much, sir. Thank you so much for accepting our invitation and delivering of such a fantastic talk. You have covered everything, and so in a so fantastic way. Yeah, we like very much, and yeah, again we will have some other program again.
Absolutely.
With the organizations.
Yeah.
Yes, thank you so much.
Thank you, sir.
Thank you, Kiran madam.
Thank you.
Yes, thank you all the AMOX office bearers and IMA office bearers. Thank you all the delegates who have joined and enjoyed this feast of knowledge. Thank you once again, Sagar sir. Thank you, Parul.
Thank you, sir. Thank you.
Thank you, Madan sir,
Yes.
for incorporating us, and thank you for making me a part.
We really enjoyed today's session. Really.
It was really nice, sir. Matlab, undoubtedly.
Really.
Otherwise, it becomes a little more. After some point in time, you just feel अभी बहुत हो गया, अभी बंद कर सकते हैं. Let's mute it, and if we are sitting in our OPDs, but we really wanted to hear it. It really was
आज
very
बिल्कुल
good.
नहीं लगा ऐसे.
Thank you so much. I really, really appreciate it. Thank you so much. Thank you.
We will meet in a physical event also. We will meet in physical
Yeah,
event
I think physical is much more interactive.
Yeah.
Physical is 10
Yes.
times more entertaining also, because then I can see the expressions of the people.
Yes.
So once I see the expressions, then I can make 10 jokes about it right there itself.
Yes, sure.
Yes, yes.
Sure, sir.
Yeah. All right.
Yes.
All right. Thank
Yes.
you.
Thank you so
Thank
much.
you.
Yes.
Thank you, sir, once again.
Yeah, thank you, Jyoti Chidgupkar madam also, and thank you everyone. Thank you, Corona Remedies, Ms. Shivani, for coordinating this event, and thank you for the support. Yes, thank you. Good night.
Good night.
See you once again.
Good night, everyone.
Good.
Yes.